You may have heard of the term autoimmune disease, but what does that mean? There can be a variety of signs and symptoms a person has to show they have an autoimmune disease. Meet a family of women that all have different types of this disease, here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps on giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. Today we're covering the broad world of autoimmune conditions with our good buddy Dr. Red. Did you know autoimmune malfunctions include conditions such as Addison's disease, celiac disease, Hashimoto's and the dreadful type 1 diabetes? Well, Dr. Red is the founder over there at Red River Health and Wellness, where they specialise and focus in helping people with autoimmune disorders. Welcome, Dr. Red.
Thanks for
having me. How are you,
buddy?
buddy?
I'm good.
Alrighty. What is autoimmune disorder?
So this is when your immune system, instead of attacking bad things, starts attacking its own tissue. So it actually thinks that certain tissues in your body are bad things. And so we'll go and mark them and start trying to destroy them to get rid of it.
Okay, how many types of autoimmune disorders are there?
There's really hundreds. Because you think about how many different
how
types.
How do you focus on them?
Well, the biggest thing is there's some very common ones.
Okay.
Ones like Hashimoto's disease, rheumatoid arthritis, celiac disease, autoimmune conditions that attack the pancreas, type 1 diabetes. I mean, so many different types, but those are the common ones.
Dr. Red, if someone has one disorder, okay, over here on the left,
yeah,
does it typically refer to other disorders as well?
Well, what we're seeing is yes. And what we're basically, if somebody has, let's say, rheumatoid arthritis, the likelihood of your immune system just attacking the joint tissue is slim. Most of the time, they're going to have other tissue being destroyed, like maybe the pancreas, or maybe the thyroid, or maybe the skin tissue, or the intestinal tract, which is a really common one to have.
Is it hereditary?
It can be, yeah. In fact, sometimes we'll have families of patients who end up having different types of autoimmune conditions, and they're all suffering from it.
Okay, more prevalent in men or women?
Women. Women are about a 7-to-1 female to male ratio.
What would you say is the most common autoimmune disorder?
I'd say right now probably the most common one is a disease called Hashimoto's disease, which is where the immune system attacks the thyroid. But then the other one on top of that is celiac disease. That is becoming a huge problem in America right now.
Isn't that just something that we throw around nowadays, that word celiac?
Unfortunately not. I think because of...
is it a trendy word?
No. It's because the quality of our food is rapidly declining, because they're trying to increase the quantity. It's causing a lot of different problems.
Dr. Red, in our show tonight we're talking to a multitude of people within one family. Is that normal that you would treat multiple people in one family?
You know, we actually do. Most times we'll see family members with the same autoimmune condition, but at the same time, we oftentimes see family members with different autoimmune conditions as well. So someone might be suffering from rheumatoid arthritis or multiple sclerosis or Hashimoto's, and you see just their family traits and the family lineage all suffer from one type of different autoimmune condition.
I didn't realize that.
Yeah.
So Dr. Red, what you're saying is it's quite common.
It is common. In fact, I had an opportunity to interview patients, a mother and 3 daughters, that all suffer from different autoimmune disorders. Take a look.
The family that Dr. Red is about to sit down with isn't just any family, she's our family. Brienne Johnson, our ex-co-host of Good Things Utah and great friend. Her mum, her sister, and she herself all suffer from symptoms of an autoimmune disorder.
Thank you so much for having us. This is so awesome to be here, and really, I think it's so interesting because we all, are from the same family, but we have such different things going on. So
yeah, tell us, what do you have going on?
First of all, Hashimoto's. I was diagnosed with Hashimoto's.
Well, I was diagnosed with celiac disease, but I've always struggled with immune system since I was young. Like food allergies, immune system, and then each child I had, I just didn't bounce back as quickly, and it took until my 3rd child, and I just never bounced back. Couldn't get on top of it, and so Brienne was introduced to Red River Clinic and you. Yeah. And then she called me immediately, said...
I knew it was a match.
Yeah.
Match made in heaven.
Yes.
She said, you have to go in, you have to go in.
Monica, what were you tell them that you were something.
I didn't grow up feeling sick like Jessica. I didn't start feeling really bad until after I had my second child. And right after I had him, I felt like my entire body went haywire. And I started having lots of gastrointestinal issues, which I had had before, but once again I thought were normal to just have these stomach problems. But they got so much worse after I had him, or my second child. And then my throat was swelling up and I didn't know why. And I just kept getting more and more sick.
And Mom, tell us what are your problems? What are you facing right now?
My biggest issues are high cholesterol and blood sugars.
Yeah.
And so that's what we've been working on, and that's helped tremendously. And when I was recently tested, I'm towards the end of the program, and about 3 months in, we did the blood work again, and my cholesterol came way down. So that was
great.
really nice.
After the break, we'll be finding out what foods trigger those disorders in a negative way. All right, Dr. Red, we're back in the kitchen.
There we are.
You like a bit of cooking, don't you?
I love it. This
Okay.
is what I live for.
Good
right
and
here.
bad foods for autoimmune system. Now, I'm not a fan of Diet Coke, but I know a lot of people are.
For sure.
It's a bad thing.
It's bad. Aspartame. Aspartame for autoimmune patients causes problems with the gut microbiota and ends up causing problems to flare up that immune condition, causes problems with blood sugar levels, all sorts of different issues. So
Okay, get rid of it.
get rid of it.
Put it to the side.
I'm
Get rid of
getting
it
rid of it
now.
right now,
All
right
right.
now.
Okay, I've noticed over here you've got some pills and also, turmeric as well.
Yep.
But let's start at the very end.
So we have resveratrol right there.
What is that?
Resveratrol is a really good antioxidant that helps decrease autoimmune conditions. It helps decrease what's called Th17 cells, which will help patients feel a little bit better. Another thing that we
What happens
have,
if I take it and I don't have an autoimmune disorder?
it's still really good for you. It's an antioxidant. It's great.
Okay, so we can have that in everyday life.
One of the best supplements right there to help with autoimmunity.
Okay, Dr. Red, the white one beside it, L-glutamine.
That's
Is
right.
that correct?
Yep, that's correct.
Good or bad, and what does it do?
Really good. Here's one problem that we're finding. With autoimmune conditions, we're finding an intestinal permeability problem. That means that the intestinal tract will wear down and the patient start absorbing certain proteins into the bloodstream that they shouldn't. And so one good thing to help repair the intestinal lining is to use L-glutamine. There's lots of research now showing that L-glutamine is beneficial for patients with
Just
autoimmune conditions.
buy it at the supermarket, or do we
Yeah.
have to get it through a doctor?
No,
or?
you can buy it wherever you want. There's lots of good sources. I prefer the powder source,
Okay,
but
why?
some like this is a pill. It just absorbs more efficiently.
Okay,
Yeah.
okay. Now you got turmeric. Love
Turmeric is excellent. One of the best things to help calm down what's called Th17 cells.
Okay.
And in autoimmune conditions, Th17 cells are a nightmare. So using high dosages of turmeric will decrease Th17 cells, help increase regulatory T cells, and help the patients feel better longer.
Which you tell us to put in our diet all the time.
All the time.
You tell everyone here.
It's really, really good. It's one of the best antioxidants that helps with all sorts
whatever.
of stuff.
Okay, the other one right here in front of it, I can't see what it is.
It's a multivitamin.
Okay.
One thing we have to be cautious is using a multivitamin without iodine. And that's
What
because
does the iodine
iodine can flare up autoimmune conditions, specifically Hashimoto's condition. So you have to be really cautious using iodized salt, iodine in multivitamins.
Is it something on the label that I would see?
Yeah.
I never thought it would be that. I know
Definitely.
iodized salt.
For sure. So check your
Okay.
multivitamin for iodine,
All right.
and don't use iodized salt either.
All right. I know you have lots of fruit and vegetables
Yeah.
here. Now, we've got some down the other end there that are from Asia.
Yeah, you got
that
a
true?
dragon fruit, you got
Okay.
a horned melon. You're exactly
Okay.
right. Yeah, you betcha.
All right.
One thing with fruits, though, we have to be cautious that we don't eat too many fruits at one time, and that's because that will cause insulin surges, which will end up flaring
is
up the
bad for
autoimmunity,
you.
which is bad for you. Exactly.
Okay.
So just eat fruits in moderation, but mainly consist your diet of vegetables and proteins for breakfast, lunch, and
I
dinner,
know.
snacks in between meals. Make sure you eat really regularly.
I know.
I know.
But it all sounds like a bore.
It's not a bore. If you-
Okay.
it's ultimately a bore to you.
I know. No,
Let's be
that looks
serious right
interesting. Okay. What have we got the other end over there? Little capsules of
yep,
something.
Vitamin D is huge. In fact, using vitamin D sublingually is really, really crucial. In fact, that will help increase regulatory T cells, which will help calm down the autoimmunity as well.
Okay. Milks.
Okay, soy increases estrogen, and too much estrogen flares up the autoimmune conditions.
Really?
Yep, so you gotta be cautious with soy. Dairy is a common thing.
So you're saying women step away from the milk?
I would. In fact, I would use coconut milk or almond milk, and we've seen that those
I
are
love
far
almond
better.
milk.
Yeah, we've seen that those are far better with our patients than using soy or dairy. One big thing that patients don't like is that gluten is a common thing to flare up autoimmune conditions as well. In fact, one of the most common things out of anything here to flare it up is gluten.
Okay, well, it's time to check in with the mother-daughter patients that you've been looking after.
Yeah.
Take a look.
When you guys calmed my system down, I feel like I was able, I just felt so much better. And when I was introducing foods, and maybe if I had a little bit of gluten, it wasn't as if I had gluten before.
Yeah.
You know, my body could tolerate it, and then I could get back, because yes, I would cheat. I'm sorry. I would cheat every once in a while. I wanted a bite of a donut, you know?
Sinner.
But
I never cheated. I'm not sure what you're talking about.
She probably didn't. She's pretty good at that.
She's actually the honest one here.
Yeah, she
is.
It's just because I get so sick. If I cheat, I get
Yeah.
the consequences are
I think
not
that's
good, so.
also too, like when you feel so much better. I mean, if you felt
Right.
terrible for 10 years and then all of a sudden you get to where you feel better and you cheat and flares it up or do
Right.
something to flare up the autoimmunity,
You don't wanna
you're
go
like,
back.
oh my
Yes.
gosh, you feel terrible, almost like a night and day
And
difference.
that's
So
the
that's
thing, people
also
will
a big
say
thing.
to you, how do you do this? How do you eat like that? You're like, well, you haven't felt as bad as I felt before,
Yeah.
so that's how.
And you know,
For
and
sure.
to see
Or
the
as good.
contrast,
It's good, exactly.
Yeah.
For so long, it's just particularly, but for so long, just thinking this is normal to have no energy, to
Yeah,
get
I'm
sick
just a
regularly.
You know.
And
Yeah.
now to know the difference, you think, I can't believe I lived that long feeling that way. But when that's your normal, it's you don't know any different, and you don't know how to change it.
Yeah.
I thought I was trying, because I cut out gluten and dairy, and I thought that'll make me feel better, and I
Yeah.
still wasn't feeling better. But then
For sure. It's
did
interesting to
with
see
gluten.
all the different types of patients that come in with like 0 to 5 good days. And they have a full day of work and mom
Right.
and all sorts of stuff, and it affects their whole life.
Coming up, we'll check in with Dr. Red at Red River Health and Wellness to find out how they test and help patients with these disorders. Closed captioning for the younger you is brought to you by Mindful Medical. Be sure to head over to theyoungeryou.tv to stay up to date with all things younger you.
One of the biggest things for us here is to help our patients understand and comprehend what's truly going on with their body. And so when we can teach these patients to be the expert in their own health and to really manage this condition, it gets to a point to where they know exactly what they can and can't do. And if all of a sudden they feel bad, they can revert back to what they did before to help really calm things down and feel better.
They ran the blood work and found that I'm pre-diabetic and that I had really high cholesterol.
I was feeling really sluggish all the time. I actually didn't know when I was sick and when I wasn't sick.
For several years, I would say from about 20 on, I didn't feel great.
I went and talked to Dr. Red thinking that I had some hormone issues after I had my first baby. I wasn't feeling like myself. I was feeling depressed and kind of, you know, down, not able to do all the things I needed to do. I didn't have any energy. I just really wasn't feeling good.
I was hopeless. I had kind of resigned myself to the fact that this was just going to be a long life, and this was the cards I was dealt, and there was no hope because I have exhausted every other resource to try to help me feel better. So I would just lay in my bed and I would get my little toddler to come up and watch movies with me, and I felt awful.
My throat was swelling up when I would eat certain food. I had gastrointestinal issues. I just kept getting so sick when I would eat.
I've had low energy for years, low iron. I remember as a little girl, I always was low on iron, and so I had to have the supplements. And so I've just kind of grown up thinking that's how I am.
I thought it was a hormone issue, and it turns out that I do have Hashimoto's, which I didn't know much about. It runs in my family, but I didn't think I had it at all. I didn't have any of the regular symptoms. So once I was diagnosed, they put me on the anti-inflammatory diet.
They have so many different problems that are causing the autoimmune response to flare up, whether it's celiac disease, Hashimoto's, or any other type of autoimmunity. And when we can finally calm these patients' autoimmune response down, their quality of life is so much better. But if these patients start to eat the foods that cause it to flare up again, it can cause havoc within a course of just 4 hours. And so these patients can go from feeling awesome to feeling as bad as they did before they started with us because of the simple dietary choice that they made.
I loved the approach that it was natural, that they didn't want to put me on a slew of medications. They just wanted to take it back down to the basics, eat very healthy, basic for 3 weeks, and then slowly introduce foods. And I was able to realize it was what I was eating that was making me feel so sick.
The interesting thing about the anti-inflammatory diet is that you have help along the way. I think all of us have tried to do certain things. Okay, I'm gonna stick to it. Okay, tomorrow I'll start. Okay, tomorrow I'll really start. But when you have someone there and you have a doctor who's actually helping coach you through, and you are accountable to this doctor, and you go through these things week after week. Let's say week 1, really hard. Week 2, you start to feel results. Week 3, you see things you've never seen in your body. All of a sudden, you're depuffing, you're not swelling, you're eating foods, and you're digesting them beautifully. You're feeling like, oh my goodness, that's how my body is supposed to work.
I loved the diet in the beginning, the anti-inflammatory diet. We worked for 3 weeks, just basic foods, and after that, slowly adding in foods to see how my body tolerated those. And I've loved doing that and being able to see the foods that are good for me, the foods that aren't, and just feeling so much better and having so much more energy.
I feel like now my kids will have a much brighter, happier future, and they won't have to go through what I went through. Because that's what was so hard as a mother, to know that they have these genes, they have these immune problems, and they're gonna live the same life I did.
Most of these patients feel like these symptoms are normal because of maybe the aging process, or because of the kids that they have, or the busy schedules that they have. But in reality, once they start feeling better and we can really help and teach them simple strategies to improve their health, they start to realize that all those symptoms aren't normal and that they can have a better quality of life, even with the busy schedule or aging or with kids.
Before, I was so sick and I didn't know what was making me so sick, and doctors couldn't really pinpoint it either. They just wanted to suggest medications to mask the symptoms. So now that I know, I feel like I can take care of myself for the rest of my life and help others, not only my own kids, but friends or others who have similar symptoms. It's been wonderful.
I am in control of my own life, and it has empowered me that I will be able to have a better quality of life because I know how to take care of myself and my family.
Starting the anti-inflammatory diet, it was like I jumped into a completely different body that I had never been in, and I had never had those. I didn't have the aches and pains anymore. I didn't have the digestive issues. I felt so good, and so yes, I did. I felt better having done the diet than I had ever felt in my entire life, and I can never remember feeling.
I can feel better, and I'm doing better, and it was so nice to be able to see 3 of my daughters go through the program first and see how successful they were, and that gave me the incentive to go in and make sure that I tried it, and it's made me feel so much better, and it's given me a whole new world.
Next on the show, I'm going to sit down with Dr. Red and ask him some viewer questions that you have sent in. Like us on Facebook for updates on the show and how to join the Younger You conversation. Now, we've met my old friend from Good Things, Utah, Brienne Johnson, along with her mum and sisters. Then Dr. Red walked me through healthy dietary options to help combat autoimmune disorders. Now, let's sit down with him and ask him some of your questions that you sent to me. So, Dr. Red, you ready for some viewers' questions?
I'm ready. Let's get
All
to
right,
it.
let's go. What are some of the typical symptoms of people experiencing autoimmune problems?
So, probably the most common one is inflammation in the hands and feet.
Fat fingers.
Fat fingers, yes,
Okay.
exactly. You might see fluctuating weight. Intestinal problems are really common no matter which autoimmune condition you have.
Okay.
So,
All right, well, next question. You need to break it down. How can someone assume they have an autoimmune disease because the symptoms aren't typical? Interesting.
yeah, that's a good question. Because your immune system, when it freaks out and starts attacking tissue, it can cause problems throughout the whole body as well. Some of the most common red flags is, one, if you're going to lots of different specialists and no one knows what in the world is going on with you, you might have an autoimmune condition. Another thing too is if you can see that since, for example, like a birth of a child, you just felt worse and worse over time and haven't really found help, that's likely that you might have an autoimmune condition as well. You might want to look into that.
Okay.
There's other different things too, like when you eat different foods and you feel worse, or when you exercise and you feel worse.
Okay.
Those can all be different
All
triggers
right,
or red
next
flags.
one is, what is the difference between the conditions, Hashimoto's versus celiac versus food allergies? That's a really good question.
Yeah, so Hashimoto's is when your immune system attacks the thyroid, Whereas celiac disease is when your immune system attacks the small intestinal tract, okay?
Okay.
And then food sensitivities are common with both conditions, okay? If you have an autoimmune condition, it's likely that you're going to have some type of immune reaction to foods. And so everyone's different though, so we don't want to treat people like a protocol, you know?
So not everyone is treated the same way.
You can't. If you treat everyone the same, you're going to fail miserably.
So it's not like giving a flu shot.
Unfortunately
as an
not.
example.
In fact, we want to identify exactly what's causing things to flare up, go in there and work specifically to that patient's problem.
Okay, what I love about this next question is, I know you'd like to see me for the rest of my life
Yes,
in
I
your
do.
office.
Every day, all day.
Do the patients need to see you forever?
No, our biggest goal is we want to inform them and teach them so that they can be the expert in their own health, right? So many patients are sick and tired.
So you're educating?
Yes. We don't want a patient just to get a pill for a symptom and that's it, right? Patients nowadays don't want that. They want to be informed, they want to be taught, they want to be educated, and that's our biggest goal, right? We want to teach them so that they're the expert in their own health for the rest of their lives. So they know how to recover from flare-ups, they know how to feel better and have a better quality of life for the rest of their life.
So what you're saying is once we're all better, you'll be obsolete?
Yes, I'll be gone.
You'll be gone.
Hopefully we can teach you the tools to kind of keep things in check for the rest of your life,
I
right?
like that one. We do wonder what it is that we actually get tested on. Is there a different test to diagnose the different autoimmune conditions, and how do you run those tests and with what?
There's a lot of different blood tests, tons of different blood tests.
So we're doing blood?
Yeah, yep,
Okay.
and we do it through the blood, and depending on what tissue we suspect it's destroying, the immune system is destroying, we run that test. But if we have a patient that comes in with multiple autoimmune conditions, or we suspect they have multiple autoimmune conditions, we have a panel that checks for the top 25 autoimmune conditions in America right now.
25?
25, yep.
What are the most common ones?
So the most common ones will be celiac disease, thyroid conditions, brain tissue, joint tissue, skin tissue, lots of different autoimmune conditions there. But it's cool because we can just, if a patient's wondering, hey, I think I have multiple autoimmunity, we can run a simple blood test, check to see if they have any one of those 25 different autoimmune conditions.
Okay, how long before you get the test results back can you start helping us?
So within 3 days we can get results back and know exactly what's causing the patient's problem and also know exactly what's causing it to flare up too. And so once we identify what those are, we can go in and build a plan to start calming things down right away.
Dr. Red, we've talked about this many times on many of our shows here, but yet people still aren't being treated properly. Why is that?
Yeah, I think one of the reasons why is because a lot of doctors are living a symptom-based model, right? They come in with symptoms, I have depression, or I have fatigue, or I have whatever it may be, and they give them pills for symptoms, and that's kind of their course of treatment. Whereas, you know, there's lots of other doctors that really want to understand what's going on with the patient, not just giving them a pill for the symptom, but really get to the underlying mechanism. And if it is an autoimmune condition, then it's way more comprehensive than you can ever even imagine to really help this patient improve. It takes a lot more work and a lot more effort.
Dr. Red, thank you so much. As always, great information.
You're welcome.
Appreciate it. It's amazing how many people go through life feeling sick, tired and miserable without being able to find out what's wrong with them. Well, the Red River Clinic has helped so many people find joy in their lives again by giving them the tools they need to control their autoimmune disorders. For more information about the show or Dr. Red, please head over to our website at theyoungeryou.tv, and I'll see you next week. On next week's episode, we are going to talk about body lifts and why it is the best way to remove excess skin after losing a significant amount of weight. You brought this story to me and you said, Troy, I really do believe this would be an incredible story to document.
This is probably the most amazing transformation that I've seen so far in 10 years.
Yeah. The Younger You set provided by Madison McCord Interiors.